the only wealthy nation.
On August 4, 2021, the Commonwealth Fund ranked 11 countries, including the US, in terms of their healthcare based on factors from equity to administrative efficiency. Not only did the US come in last overall, but it also ranked last in all but one of the factors. How did we get here?
Today, we know the United States as a country with a strong government, economic might, and cutting-edge medical research. Yet, despite this strength, many Americans cannot access one essential resource: healthcare. The idea of health insurance provided by the federal government came into the scope of politics during the 1940s, with President Franklin D. Roosevelt's expansion of the government by provision of welfare and social services. In 1944, he outlined the Economic Bill of Rights, formalizing health insurance as a right for all Americans. About 20 years later, President Lyndon B. Johnson's Great Society laid down the framework for federal insurance. And in 1965, LBJ signed the Medicare and Medicaid programs into law. Over the past 60 years, the United States federal government has tried to insure more Americans. During the Obama administration, the push for universal health care through the Affordable Care Act was revitalized. Despite this, the 2020 US Census reports that 8.6%, or 28 million Americans, were not covered by health insurance at any point throughout the year. What this really means is that despite the efforts of our federal government, millions of Americans are still falling through the cracks. To understand why we put such a premium on public health, we first have to look to the federal system of healthcare. Phil Dalton, Professor of Practice of Public Health Policy and Management from the University of Southern California, explains the foundation for the federal system of healthcare.
For the most part, we evolved in a direction that people got insurance through their employer. And then we tried to fill in the gaps, with Medicaid and Medicare. And so, there's a bunch of gaps that were left in that evolutionary model.
Currently, the federal system of healthcare is split between two programs, Medicare and Medicaid. Medicare is primarily for Americans over the age of 65, but the main area that falls short is the Medicaid system. Why? Because even though Medicaid is a federally established program, qualifications vary over state lines. According to the Center on Budget and Policy Priorities, each state operates its own Medicaid program as long as it's within federal guidelines. But this branches off into two problems. One, many Americans can't qualify, and two, those who do qualify aren't receiving enough coverage.
And this brings us back to the 28 million Americans without coverage. They don't qualify for either Medicare or Medicaid, and cannot acquire insurance for themselves or access employer-based resources. This shows that the holes the federal system intended to fill still remain prevalent today.
I would say a big part of the gap is with Medicaid, because first of all, it varies by state, and there's a lot of states that didn't expand the coverage for Medicaid. And then the other gap is you can't find a physician necessarily if you're in a rural area.
When working with such a large system involving millions of Americans, the stories of individual patients who have been affected are easily drowned out. Here's the story of a Medicaid recipient whose struggles in the past illustrate just a fraction of what Americans can face every day.
There was one time where my children developed acute gastroenteritis, and even though we knew we couldn't afford a doctor's help, they suffered severe vomiting and diarrhea, so we didn't know where else to go. The doctor we went to was kind enough to give us back our money and to give us the medication for free.
If not for the help of a willing doctor, Shirley's children would have faced serious health consequences. Not all stories like theirs have such a happy ending. In 2009, the American Journal of Public Health estimated 45,000 deaths annually associated with a lack of insurance. That figure was 2.5 times higher than it had been in 2002. It was devastating then, and it's only worse now. In the midst of a pandemic, Families USA, a nonpartisan health organization, reported a study linking 1 in every 3 COVID-19 deaths to health insurance gaps. In fact, more than 40% of all COVID infections are similarly linked to insurance gaps. The United States is currently facing the unique challenge of handling the consequences of the existing healthcare crisis in light of the pandemic. Now, more than ever, we need solutions. So, despite a powerful government, economic might, and the cutting-edge medical research that we associate with the United States, the federal government still has a long way to go to ensure that all Americans receive the medical care they need. This will require understanding the system, but more importantly, listening to all voices in the issue, so that one day we can hope to lower the premium on public health.